Are you suffering from depression and considering medication as a treatment option? Two commonly prescribed antidepressants, Zoloft and Prozac, are often recommended by healthcare professionals. But which one is better? In this video, we will compare Zoloft and Prozac to help you make an informed decision based on your specific needs. Zoloft and Prozac both belong to a class of medications called selective serotonin reuptake inhibitors, SSRIs, which work by increasing the availability of serotonin in the brain. However, they have slight differences in their chemical structures and mechanisms of action. Understanding depression and its treatment options. Depression is a serious mental health disorder that affects millions of people worldwide. It is characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities that were once enjoyable. While therapy and lifestyle changes can be effective in managing depression, medication may be necessary for some individuals. Antidepressants are commonly prescribed to help alleviate the symptoms of depression and improve overall well-being. Zoloft and Prozac are two popular options in this class of medications, but they have distinct differences that may influence your choice. How Zoloft works in treating depression. Zoloft, also known by its generic name sertraline, is a widely prescribed medication for the treatment of depression. It works by selectively inhibiting the reuptake of serotonin, a neurotransmitter that plays a crucial role in regulating mood. By increasing the levels of serotonin in the brain, Zoloft helps to alleviate the symptoms of depression. One of the advantages of Zoloft is its versatility in treating various mental health disorders. In addition to depression, Zoloft is also approved for the treatment of anxiety disorders, panic disorder, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. This makes it a suitable option for individuals who may be dealing with multiple conditions. How Prozac works in treating depression. Prozac, known by its generic name fluoxetine, is another commonly prescribed antidepressant. Like Zoloft, Prozac is an SSRI that works by increasing serotonin levels in the brain. However, Prozac has a longer half-life than Zoloft, which means it stays in the body for a longer duration. Prozac is primarily prescribed for the treatment of depression and panic disorder. It has been extensively studied and has a long track record of effectiveness in managing these conditions. Prozac may also be used off-label to treat other mental health disorders such as bulimia nervosa and premenstrual dysphoric disorder, PMDD. Efficacy and effectiveness of Zoloft in treating depression. Numerous clinical trials have demonstrated the efficacy of Zoloft in the treatment of depression. In a study published in the Journal of Clinical Psychiatry, Zoloft was found to be significantly more effective than a placebo in reducing depressive symptoms. Another study, published in the Archives of General Psychiatry, showed that Zoloft was equally as effective as other SSRIs in treating depression. The effectiveness of Zoloft may vary from individual to individual, and it may take several weeks for the full effects to be noticed. It is important to follow the prescribed dosage and consult with your healthcare provider regularly to monitor your progress. Efficacy and effectiveness of Prozac in treating depression. Prozac has also been extensively studied and proven effective in the treatment of depression. In a meta-analysis published in the Journal of Clinical Psychopharmacology, Prozac was found to be significantly more effective than a placebo in reducing depressive symptoms. Another study, published in the Journal of Affective Disorders, showed that Prozac was equally as effective as other SSRIs in treating depression. Like Zoloft, the effectiveness of Prozac may vary from person to person. It is important to note that individual responses to antidepressant medications can differ, and it may take time to find the right medication and dosage that works best for you. Side effects and safety considerations of Zoloft. While Zoloft is generally well tolerated, it can cause some side effects. Common side effects of Zoloft include nausea, diarrhea, dry mouth, dizziness, and sexual dysfunction. These side effects are usually mild and tend to improve over time. In rare cases, Zoloft may cause more serious side effects such as serotonin syndrome, which is a potentially life-threatening condition characterized by agitation, hallucinations, rapid heartbeat, and high body temperature. It is important to seek medical attention immediately if you experience any severe side effects while taking Zoloft. Zoloft may also interact with certain medications, such as monoamine oxidase inhibitors, MAOIs, leading to a potentially dangerous condition known as serotonin syndrome. It is crucial to inform your healthcare provider about all the medications you are taking to avoid any potential interactions. Side effects and safety considerations of Prozac. Prozac, like Zoloft, may cause some side effects. Common side effects of Prozac include nausea, headache, insomnia, nervousness, and sexual dysfunction. These side effects are usually mild and tend to diminish over time. As with any medication, there are potential risks associated with Prozac. In rare cases, Prozac may increase the risk of suicidal thoughts or behaviors, particularly in children, adolescents, and young adults. It is important to closely monitor any changes in mood or behavior while taking Prozac and to seek medical attention if necessary. Prozac may also interact with certain medications, such as monoamine oxidase inhibitors, MAOIs, leading to a potentially dangerous condition known as serotonin syndrome. It is crucial to inform your healthcare provider about all the medications you are taking to avoid any potential interactions. Choosing between Zoloft and Prozac. Factors to consider. When it comes to choosing between Zoloft and Prozac, there are several factors to consider. These include the specific symptoms you are experiencing, any coexisting medical conditions, potential drug interactions, and your individual response to the medications. It is important to work closely with your healthcare provider to determine which antidepressant is the best fit for you. Your healthcare provider will take into account your medical history, current symptoms, and any other medications you may be taking. They will also consider any potential side effects and interactions to ensure the chosen medication is safe and effective for you. It may be necessary to try different medications or adjust dosages to find the one that works best for you. Patience and open communication with your healthcare provider are key in the process of finding the most suitable antidepressant for your needs. Conclusion: which antidepressant is right for you? In conclusion, both Zoloft and Prozac are effective antidepressants that can help alleviate the symptoms of depression. They belong to the same class of medications, but they have slight differences in their chemical structures and mechanisms of action. Zoloft is known for its versatility in treating various mental health disorders, while Prozac has a longer half-life and a well-established track record in managing depression and panic disorder. Both medications have potential side effects and interactions, so it is important to work closely with your healthcare provider to determine the best option for you. Remember, finding the right antidepressant is a highly individualized process. What works for one person may not work for another. It may take time and patience to find the medication and dosage that effectively manages your symptoms with minimal side effects. If you are considering medication as a treatment option for depression, consult with your healthcare provider to discuss your symptoms, concerns, and any potential risks or benefits associated with Zoloft and Prozac. Together, you can make an informed decision that aligns with your specific needs and helps you on your journey to overcoming depression.